Hello, this is the Winnebago County Health Department's TV show where we talk about public health and relate it to your health. I'm Alana Erickson, and today we have some guests doing some truly collaborative work around mental health in the region. I'll let them go ahead and introduce themselves and their roles.
My name is Beth Clay. I'm the Executive Director of the Northeast Wisconsin Mental Health Connection.
Okay.
And my name is Rachel Podosky. I am the Project Evaluator of Healthy Teen Minds.
All right, so Beth, you're here today to talk a little bit about the program, where it started. Just give us a little brief introduction.
Sure. So the connection was created in 2011 after we had a community health action team plunge around mental health. And the community really decided that they wanted to handle mental health in our community with a wide range of stakeholders, not just the traditional thinkers in healthcare. And so we are a membership organization, and we include school districts and health departments and health systems and everybody from the community to work on kind of the system level issues within mental health.
Mm-hmm.
We were really well positioned for a grant opportunity. It's an 8-year grant to look at the behavioral health of our region of Outagamie, Winnebago, and Calumet counties. And we are doing that together, looking at the rate of teen depression in the valley.
Okay, so you got this grant last year, correct?
That's right. So we're in 1 year to the 8-year grant. Year one was a planning year, which meant that gave us the opportunity to really dive into our local data, to look at the literature and understand what the driving factors are behind teen depression, not just kind of our mental models and what we think is going on, but to really understand the problem so that we could figure out what the leverage points were. So we know kind of what data points do we need to move to really see a difference at the population health level for the rate of depression or risk for depression in 12 to 18-year-olds.
That seems really important for an 8-year grant to take that time to really plan. So what did you find in this first year of data diving?
That's a great question. So let me say one more thing about the kind of the format. So now we're in year 2, and we have 5 years of implementation. So the plan that we came up with, we now have 5 years to roll it out, and then it also includes 2 years of sustainability planning at the end. So we want this to not just come here, but to stay here. And so we learned a lot about what drives depression in our kids. Some of those things include their sense of connectedness at school and whether they feel like they have peers and a trusted adult at school. Their sleep impacts their mental health, especially the rate of depression. Whether they have access to services and proper screening at their age to find out if what they're experiencing is normal or not normal. And so we have lots of different strategy points to try to move those things.
All right. And Rachel, you were key in looking at that as the evaluator, correct?
Right, that's exactly right. When we went into the planning year, we didn't know what our project would focus on. So it took a good 6 months of engaging with local stakeholders until we settled on youth depression. And once we had kind of set our sights on that age group and that topic, we looked to the Youth Risk Behavior Survey, or the YRBS, and that showed us how we're doing in the region. And what we saw was this slow but steady increase in those who are reporting sadness and hopelessness for 2 weeks or more. It went from about 22% to 26% in a total of 6 years, which might sound small, but is very significant from a statistical perspective and represents about almost 1,500 kids every year.
That's quite astonishing. So who are you looking at? What are the age ranges?
So the goal of the project is to reduce reported rates of depression in adolescents in grades 7 through 12 or ages 12 to 18. So that's really our target population. But when we were looking at strategies and many of the factors that Beth mentioned, we wanted to incorporate strategies for that age group, but also more upstream. So for that age group, we are implementing an evidence-based program in high schools called Sources of Strength. So this year that's happening in Oshkosh, Neenah, and Appleton, and then will be scaling it up to more districts each year. But to move more upstream, we are working with elementary schools and the Department of Public Instruction. They're really championing some work around social learning and emotional regulation, which will give these kids resilience and coping skills for years to come.
Sounds good. So we were kind of talking earlier about what's really been a good success and where you're getting the greatest support, and you talked about the willingness of school districts.
Yeah, the schools were really important adopters for us, and fortunately those 3 districts were our early adopters. They understood what we were doing. They felt like it was a good fit for how they wanted to roll out the mental health care of their students. But we'll be scaling it over the 5 years to hopefully all 24 school districts in our region. We also want sources of strength to reach the rest of our community, and so we chose to train a trainer within Boys and Girls Club because before and after care is a part of a child's school day, but that also brings more trusted adults into the community that are using that language and sharing the sources of strength as a way to cope and manage with life.
Can you explain the trainer just a little bit more?
Sure. So that's one of the really key parts of us leveraging the dollars that are coming to us. So over the 8 years, we have $1.2 million coming into the community to help us set these things up. But we were able to pay more than half for each of the initial school districts, train a trainer, and that will allow us by year 2 and 3 for the cost to go down per school from $5,000 to $750. So we feel great about our ability to leverage this and make it possible for all of our tiny districts as well.
That's great.
And having a local trainer will really help in those 2 years of sustainability in ensuring that it's embedded in the community. So it's kind of a best practice for sustainability.
Great. So it sounds like the partnerships and the willingness of schools has really been a strength for you guys. What's been a barrier?
Well, I would say one barrier is, or it might be a perceived barrier because I don't feel this way, but the fact that we have 24 school districts in our region is really significant, especially when you compare us to some of the other regions of the state that are doing this that might just cover one county or maybe 2. This is really a significant number for us, but we have the plan to roll it out over the 5 years and feel confident in that.
Great. So what can the general public do then to support these efforts and help out the connection?
Well, I think there's certainly a lot of public awareness around this subject and growing awareness through the Life Study and the Kids in Crisis series. We know that our rates of suicide attempting are really high in the region, and that goes hand in hand with depression. So first, I would say just being aware of it, and then talking about it. If you know someone in your life who is struggling with mental health challenges, understanding that it's a normal part of life, and just being able to have that conversation.
Absolutely.
Anything to add to that?
I would just say that one of our other initiatives in connecting people to mental health services is our website, myconnectionnew.org, which is a place where people can really navigate services and search for and find appropriate services for the age group of the person that needs them, the particular issue they have, whether their insurance is covering it, and all of that kind of stuff. And so we hope that people will use that resource to navigate services and also to gather mental health information and substance abuse information.
Great. And we did put together a short little clip to show the audience, kind of introduce them to that website. But before we cut to that, I just wanted to thank you guys for both coming on. Thank you for the wonderful work you're doing. And I'm sure that if anyone wants to know more information about how they can support your efforts or get involved, they should just contact you guys through the website, or?
Absolutely, that's the best way to do it. And we just want to say thank you to the Winnebago County Health Department, who's serving as the fiscal agent for this project. We're very grateful.
Great, it's important work.
And you can also find us on Facebook.
So. Ooh, good to know. All right, so with that, we're going to introduce you to the website. Have a look.
Before we take a 2-minute tour of myconnectionnew.org, the New Mental Health Connection would like to acknowledge our partners at United Way 211 for generously sharing their directory of mental health and AODA resources. In total, this website has compiled a directory of over 300 providers across the Tri-County area. And when you visit the site, this is what you will see on the homepage. You will notice the Need Help Now button, which will pull up a list of local and national crisis lines. And if you are accessing the site from a mobile phone, those telephone numbers are clickable. This red button appears in the same place on every web page as you navigate around the site. Another useful feature is the option to change the display language or to view the site in large print. By integrating all text with Google Translate, there are over 100 language options, as well as professional translations for 14 of the most common languages. On the right-hand side, the blue box that says Check Up from the Neck Up is a link to an anonymous screening tool developed by Screening for Mental Health, Inc. It is totally free and guarantees your privacy and security. You can answer questions for yourself or on behalf of a loved one. Two of the most popular links are the library, which is similar to WebMD but specific to mental health and AODA-related diagnoses, treatments, and prescription options. And last but not least, the Services tab. Here you can search by category, agency name, or keyword. Advanced search allows you to enter your zip code and language preferences. This search functionality also appears on the homepage. There are many more features on the site, and we want to encourage folks to visit myconnectionnew.org and explore all that it has to offer.